is GNTV, releasing life.
Okwelinda nkukira okutambirwa kana amagara ngakira amagana.
Hariho abandi abinanye ndagambaho omushaho abakoza ekitweta traditional eye medicine ebishaka very dangerous.
Program manya amagara gawe ntukusyaho abashaho abakugu.
HPV vaccine ekingira kanseri n'obwanenda 90%.
Bakushomesa ebintu bitari bimwe na bimwe ebibwakwasa kukora kugira ngo oture amagara marungi.
It is very important tujahirwaro omanya amagara gawe exposure tukenezo mbazi nazo ne ARVs osmira for 1 month abo kubaka aka virus kakatakairo museriro muntu tokafuna kamuka kataire muntu wafuna HIV.
Ebyona ntubikora okufutaho empinda hinduka omuka yawe n'omuhereza wawe Twishe Nicholas aha GNTV.
Omulebo mulungi nakwakira program yawe nyamulungi manya amagara gawe aha GNTV. Amazina niraka ni Twishe Nicholas alikuwa kutwara omulyeji program nga bulijo ntubaletera abashaho batari bamwe na bamwe omushunga ezimu kuba mwenda kumanya kandi ebyo erimu kuba minoko muka tukubateganisa mbwenu ntuleba abantu bingi batandikire okufa abwenshonga yokweha emibazi, what we call self-medication. In this setting, we decided to come to a real person. These people who deal in drugs who are known as pharmacists. Twambaletera kugira ngo aize achoronjere enshonga zitari zimwe na zimwe tumanye omuntu ogwe alukubana yaha embazi eyitweta muni OTC, over the counter drugs. What can be the effects, what can be the risks in your life. Right now, let us go in a short break, then we come with our medical profession. Don't go away. Welcome back to our show, Manya Amagaragawa, the health show on GNTV. As we told you, we shall be having a visitor and who is known as a clinical pharmacist. Right now, let us welcome her to introduce herself, then we start off.
Thank you for the welcome and greeting, and nice to be among you in this show. And I hope all will be benefiting from these short minutes that we will be interacting in. And I will give you a brief introduction about me. My name is Einas Mohammed Elhabib. I'm a clinical pharmacist by profession. And I'm from Sudan, and I hope this show will give you a positive feedback and to know well about the OTC, which is the over-the-counter drugs, what to avoid, what to take care of, and what to know more. And thank you.
As we told you that we shall be coming with a medical profession. Right now, as she has introduced herself, she's a clinical pharmacist. Let us jump into our show. Doctor, we wanted to know about what exactly self-medication is.
Okay, thank you for your question.
Yes.
Actually, self-medication, according to the WHO or the World Health Organization, is defined as the drugs or the treatment used to self-diagnose symptoms or conditions without taking any advice from the healthcare professionals, or it's a continued use of already prescribed medications for a similar condition.
Yes.
This also includes herbal and traditional medicines.
Why do most people engage in it?
Okay, the usual engagement comes from like emergency situations, and they are hesitant or reluctant to go to hospitals, and also regarding earlier perception of medical knowledge, which can be interpreted in a wrong way. So these are all serious conditions which people must take care of.
Yes. What are the risks that are associated with self-medication for the people who use over-the-counter drugs?
Actually, the seriousness of self-medication can even lead to organ damage and failure,
Yes.
including kidney, liver, heart. All of these organ collapses, and even this will lead, unfortunately, to death in serious conditions.
Yes. Most of the people, when you engage them, they are in villages and towns. They normally say that you people, the medical doctors, you always want a very big fee for the consultation, and that's why most of the people, they just use over-counter drugs so that they can treat themselves. I don't know why. Why do you get a lot of big money for consultation on those people?
Actually, consultation should be free. It
Yes.
should be free for the public who approaches you with different conditions, different complaints.
Yes.
So this is the plan which should be prevailing and being done now, and should be done later on,
Yes.
for the sake of the humanity.
Yes. What are those drugs which our viewers can be, who are watching us right now, can know that these are the most dangerous drugs which someone cannot go on self-medication to use them before consulting you medical doctors?
Okay. Regarding some of the commonly used OTC medications, the ones used as painkillers,
Yes.
for example, mostly people use paracetamol
Yes.
for headache, and some of the ibuprofen, which is a non-steroidal anti-inflammatory drug.
Yes.
In serious cases in overdose, this can lead to liver problem and kidney problems. Beside that, we have also the cold medications and the nasal decongestants. These can even lead to serious cardiac problems. Beside that, we have also the motion sickness. It can cause to hallucination and euphoria. These are the usual serious conditions which people should avoid. Beside that, also the cough medications. They lead to addiction and dependence, which is widely prescribed, and serious strategies have to be taken to avoid such conditions.
Yes. Most of the people, when they are using over-the-counter drugs, some of them they do underdosing, others do overdosing. What can you tell those people who normally use underdosing? Because in most villages where I've been going, you would find someone, if he's diagnosed with malaria, and most of them use public health clinics. They tell them that give me half of the coartem, that is the most artemisinin, which is commonly used here in Uganda. He just take halves, or she take halves. When she sees that those symptoms have gone, then stops from there. What could be your advice? Those people who take underdose and they just see that they are getting fine and they leave the other dose.
Okay, this is a serious condition which can even lead to resistance and medication failure. So, as part of a medical professional team, all the pharmacists should stick to the prescription, and they should ensure that the 5 rights are being prescribed. For example, the 5 rights include it's the right patient, the right dose, the right drug, and the time, and even the duration. If these 5 rights are being practiced in the right way, all of these effect will be demolished and diminished. So they have to stick to these rules to avoid under and overdose, and we should counsel the patient towards even reading the leaflet, and to stick to the prescription throughout the dosage regimen.
Yes. That person who takes the underdose or the overdose, what can be the effect when the resistance comes in?
Okay. In case of resistance, the patient will require a higher and more advanced class of what he's been taking.
Yes.
This condition is common in antibiotics because, for example, some patients take they don't differentiate between the cause of the infection. It is viral or bacterial.
Yes.
So they start taking the antibiotic whenever, as you previously mentioned, the symptoms are stopped, they will stop taking that.
Yes. The watchers of GNTV and everyone who is right now watching us, the doctor is trying to tell us that if you go and take anadose or you take overdose, this will result into you being resisted by certain drugs, and it is going to require you to go on an advanced medication, and which I know can be expensive for you. Luther, what could be the risk of some of those people who use multiple combined drugs without consulting you, the health workers?
Okay, thank you. This is an important question.
Yes.
In other words, multiple medications is called polypharmacy.
Yes.
So when we say polypharmacy, it's like a couple of medications. People are not aware of the adverse drug reactions. It can lead to serious drug interactions, and they are also not aware of drug-drug interactions and drug-food and drug disease-related issues. So these must be counseled by the pharmacist elaborately to avoid any fatal effects.
Yes. Most of you, the pharmacists, someone can come to the pharmacy and say that I need these drugs without that person asking the age of that person. Because I'm seeing most of the youths are the ones who people who go there to buy drugs for their elders at home. Which age is affected when using these self-medicated drugs?
Okay. Usually the elderly, because they are having too many comorbidities by this age. So whenever they have a mild complaint, they suggest, or according to the perception they have, they will take OTC and they send their relatives to buy for them. So they are not aware of these interactions beside the medicines and the medications they are already taking for the other comorbidities like the hypertension, diabetes, and other related diseases.
Yes. The caretakers in here, they come in, and most of the people who are doing self-medication and the elderly, as you said, they have caretakers. And when I don't know which type of caretakers should be available for these elderly people, so that they cannot find any other health condition underlying for their health, which they already have.
Okay, healthcare, at least they should be in a well-literate place and family also. If they don't have any person in the medical field,
yes,
they should be aware of the leaflet of the medicines. To avoid interactions, they should be aware of the contraindications, what to avoid, what to take with prescribed duration.
yes.
And some medications need to be taken separately, within 2 or 4 hours separate. So all of these information should be well known by the patient's healthcare takers.
Yes. Most of these people who do self-medication will find someone and he tells you that what I do, I just go on the pharmacy, I buy what I want, then I get relieved. Do these self-medicated people end up getting other diseases?
Of course, these drugs can even lead to other diseases. So they should restrict the use of OTC drugs to the mild conditions. But in case it is a serious condition, like they have shortness of breath, they have persistent digestive problems, they have painful urination. These are the serious conditions that they should not use any OTC. They should approach a clinic or hospital where they will get the full treatment.
You as a profession, what signs can you see on a person and know that this person has been using self-medication or over-the-counter drugs?
By the prolonged use of OTC medications, for example, antihistamine, it is the person will be usually drowsy most of the time, And other medicines also may reflect lack of coordination, irritability. So dependence also can be noticed. So all of these signs can indicate that the patient or the person in front of me is having it's like habitual and engagement in the medications.
Yes. Have you ever encountered a patient who, a live patient who have been suffering from self-medication?
Okay, this is a live example. Actually, I have 2 cases while practicing my profession.
Yes.
It was one like herbal medicine or herbal traditional product. It is called cress seed. This cress seed is good in lowering blood pressure. It's good in immunity and diabetes and used as a laxative. The usual dose for this herbal medicine, it is to be taken as a 1 teaspoonful per day, every 2 or 3 times a week. So this patient have known this information. So as an aim to reduce weight, the dose was taken daily, and it should be taken every 3 times a week. So he came with severe diarrhea and vomiting, GIT upset, because it was overdosed. The second example is regarding antihypertensive. One of the patients approached the pharmacy during my duty. He's complaining of severe weakness and hypotensive. So when I am taking the comprehensive history, I came to know that he was complaining of severe headache the past few days, and his neighbor, who was already taken atenolol and antihypertensive, suggested for him to take this medication. So this conflict, like headache and hypertension, so he took that medicine, which led him to be severely hypotensive. So he was admitted to the short stay, and these are the serious conditions for cases of self-medication.
Thank you very much, Doctor, for what you did for those people, and I believe they are still alive. Now, Doctor, I've talked about something called herbal medication. What is the difference between these usual drugs and herbal medicines, which we hear that are always sold in pharmacies also?
Okay. Herbal can also be named as traditional medicine. It's like different countries have different plants which have different medicinal effects. These are being extracted in a medicinal way to treat certain effects within the prescribed and the known dose for that disease or condition. While chemicals or drugs are chemically formulated to treat these conditions and symptoms. These are the main difference. This is from a plant origin, and medicines are from a drug or chemical origin.
Most of the people outside there, they are resorting to herbal medications more than the chemical medicines. You as pharmacists, what do you see behind all this?
Okay. Regarding the herbal and traditional medicines, it's a good approach to avoid chemically treated conditions, but they should be strict in using these herbal and traditional medicines within the recommended doses, which will be prescribed and described by the pharmacist or the person in charge to avoid any worsening cases or overdose.
Yes. Most of these herbal medicines, they are made by the local people, the people in the villages, and most of the people, they want those drugs, and behind all that, those people who manufacture them, they are not learned like you. I don't know why you people don't get involved in making the herbal medicines so that people can perfectly understand what they are taking.
Right, you are right in your raising such a point. They should be done by experts and profession, and not by illiterate people or just by the practice.
Yes.
So this condition should be, we have to raise it so that the practice is improved through healthcare professionals.
Yes.
And to avoid misuse, overdose and underdose.
Yes.
All of this is for the benefit of the people, to avoid any serious side effects or misuse.
Yes. In all this, doctor, why we dealing in self-medication, we are seeing most especially people who are women. These women, they have got a lot of skin cancer because of the chemical drugs, which they call the jellies. And these things, we know they are manufactured. Some of them, they are manufactured by the local people, others are manufactured internationally. And they are causing serious cancer among the women. What is your advice towards those women? I know every woman likes to be brighter, but I don't know exactly what is put in those jellies. What could be your advice to women who normally use every jelly they find on their skin?
Okay, this is a huge topic we have to discuss, but I will just brief.
Yes.
Because what is currently being used, it is like creams, gels, or other topical applications are used to treat certain skin conditions like eczema, redness, inflammation. So those other people are using it for other conditions which they don't have. So I advise all those women who are using such topical applications to avoid them and to protect their skin in a natural way. And as these chemicals that they apply topically, as you already mentioned, it will lead to cancer, which you know how serious it is. And please stick to the conditions. Unless you have any condition or medical situation, please try to avoid such topical application. And I wish you a safe, healthy skin.
Thank you very much. Right now, let us run into a short commercial break. Then we come in, because most of the people in here, Doctor, since you started this one, we wanted to know, are these makeups medicines? Are they just being used for just? Then we come up with the prevention of how we can prevent these people from being self-medication.
This is GNTV, releasing life.